Hello and welcome to another live broadcast with MedStar Health. We'll discuss risk factors, symptoms, treatments, and more. So if you have questions about coronary artery disease, ask them in the comments and be sure to let us know that you're watching by liking this broadcast and sharing it with your friends.
What I refer to as classic symptoms of coronary artery disease. And one that you may hear about most commonly is chest discomfort or chest pain, particularly when you're trying to be active. So when you're trying to exercise, and it may go into the neck or into the arm, and then it gets better with rest. So, people will stop and they think they're fine. So that's the classic symptom. Now, the thing about women is that they may not experience the classic symptoms, gas pain or acid reflux is one of the common things that they may mistake the chest discomfort to be. So you have to be vigilant, and it takes a doctor, who's paying attention to really ask the important questions so that they can discern whether, is this really a heart problem or it's something else.
Thank you. So Dr. Shu, if you have those symptoms and you go to the doctor, how would you diagnose them with coronary artery disease?
Yeah, we are, to diagnose coronary artery disease, we have a lot of different ways. I break it down into invasive testing and non-invasive testing. Usually we start with non-invasive testing. That might include blood work, checking your cholesterol level, asking you about your family history, what other risk factors you may have. And then part of non-invasive testing depends on how strongly we feel that there might be something going on. So usually you hear about stress tests for patients, and usually we try to reproduce the same symptoms that you're having. It may or may not include an imaging portion with the stress test. So we may look at the heart muscle directly with an ultrasound, or we may use a nuclear medicine scanner to look at the heart. That gives us a better clarity into the heart, whether there's a lack of blood flow to it. Moving on to invasive testing, the gold standard is a test called a coronary angiogram, or also known as a left heart catheterization. They're the same test. So invasive means we have to go inside the body. There's a little bit more risk involved with that, so that's why sometimes it's not the first test we order. We use a small tube, and that's the catheter part, and we use the body's natural highway, the arteries that we already have, to get back to the heart. Once we're at the heart, we inject dye under a live x-ray machine and look at the blood vessels. It should look nice and smooth like a river, but if we see a dam in that river or blockages in that kinks, things like that, that suggests that there is something going on and that the symptoms may be related to coronary artery disease.
Okay, thank you. Dr. Quarrie, is it preventable?
Well, the short answer is probably not. There are certain risk factors associated with it, and once you start to develop coronary artery disease, there are things that we can do to help to slow the progression of the disease. But there is no treatment per se that can stop the disease from ever developing. So, it's important to speak to your doctor and talk about your risk factors. And if there are risk factors, then there are certain medications that you can be placed on that can help to slow the progression of the disease. And, medicine has come a long way, and our knowledge is developing exponentially, and medications are getting better. So there are things that that you can be treated with to help with that. That being said, there are other things that we can do that are in our own control that can help slow the progression of the disease. So certain lifestyle choices like smoking is it's a big risk factor that can actually accelerate the progression of coronary artery disease. That's something that's within our control. So, patients who smoke, they should really stop smoking. Other things such as diet, decreasing the amount of sodium that we take, limiting the amount of sugars, processed foods that we take in, and other things that can help slow the progression to exercise. Exercise is a great way. It's beneficial to your body in multiple ways.
Right.
So that's something that we can do to help slow the progression. And when I say exercise, anything that increases your heart rate, we're talking about maybe 30 minutes a day, at least 3 times a week. That's some of the recommendations that are out there. All those things can be beneficial in helping to really slow the progression of coronary artery disease.
Thank you. So if you're just tuning in with us, we are live with cardiothoracic surgeon, Dr. Ricardo Quarrie, and heart failure and transplantation cardiologist, Dr. David Shu, and we're discussing coronary artery disease. So now that we've talked about what it is and how it's diagnosed and what we could potentially do to help slow down the progression, let's talk about causes. Dr. Shu, could you talk about what causes coronary artery disease?
Yeah, there's a lot of different reasons. Some of them are preventable, some of them are not preventable, as in, you're born with it. That might include your family genetics. So if you have family members who also have coronary disease, it may be a predilection in your family. Another thing that you can't alter is men seem to have more coronary disease than women. That's something you can't change. Getting older, as we all get older, we start developing more and more coronary artery disease. That's something we can't change. Talking about other risk factors, there are some things that we can change, and those are things that we focus on more to try to help get it under control, basically. So, like Dr. Quarrie says, smoking is a major risk factor that we can modify. When you have other medical conditions like high blood pressure, diabetes, other diseases that might affect your liver, your kidneys, all those things can make coronary disease worse. So it's very important to have a doctor who's in tune with everything and making sure you're on top of it when it comes to things that we can modify. Your A1C number, your blood pressure, things like that.
Mm-hmm. Can you talk a little bit about your A1C level? What is that?
Yeah, so it's very important. So A1C is a number, a blood test that we check. It's about a 3-month running average of how high or how normal your blood glucose is.
Okay.
It's a great way to get an average of how your medications are doing in the overall picture. Sometimes you check your blood sugar and it's way high or way low. That might not be very representative of how good or how bad your diabetes is being controlled. Mm-hmm. So that average really helps us to say, okay, the trend is you're getting better or you're getting worse. That allows us a kind of a bigger picture overview of the general direction that we're heading. Mm-hmm. And that's something that a diabetes doctor might be checking, or your regular doctor.
Okay, thank you. Dr. Quarrie, is Ca D reversible?
That's a very good question. Again, so a little more nuanced than that, but it may not be completely reversible in what people generally think of when they hear that term. But again, it can be managed. Okay, and this is where it takes good coordination between patients and their physicians. Okay, so again, some of the things that we mentioned before. So certain lifestyle modifications are very helpful in helping to slow the progression of disease. As Dr. Shu mentioned earlier, as we get older, we do start to develop. We all start to develop some degree of coronary disease, but there's just a certain portion of the population where that accelerates to the point that it becomes significant. And certain changes and adjustments that we can make in our lifestyle can help to slow that progression. So diet, exercise, if you are a diabetic, making sure that your blood sugars stay under control. If you have high blood pressure, making sure that you work with your doctor to get that under control. And then again, if you are on medications, making sure that you take your medications consistently. So making sure that you're on the proper treatments, and this is where a team approach between your primary care and your cardiologist may be helpful. So it's not something that you can completely take away, but again, you can slow the progression of the disease and you can help to minimize your risk.
Great, thank you. What happens if it goes untreated, Dr. Shu?
Yeah, I think when it goes untreated, the worst case scenario is when you get rushed to the emergency room with a big heart attack. And that can happen different ways. You know, you could pass out on the floor in the middle of a parking lot or by yourself where there's no help. That would be the worst case scenario. Or maybe there's a family around, they call 911. We're getting, better and better in recognizing a big heart attack when they come to the emergency department. The EMS that comes out, one of the first things they do is to look for a heart attack when they hear about somebody passing out. So we're getting better and better in recognizing it, but we still don't want that to happen. We don't want to have somebody have a massive heart attack outside the hospital where it could have been prevented.
Right. So does CAD put you at higher risk for a heart attack, Dr. Quarrie?
Yeah, so the short answer to that question is yes. So CAD, coronary artery disease, is basically the process where you start to develop blockages in the blood vessels that feed your heart, as Dr. Shu mentioned earlier. And what happens is, as those blockages become tighter, your heart muscle is starved for oxygen. When you have a heart attack, that's when there's not enough blood flow and oxygen get into your heart muscle, and that muscle starts to die, and that's why we develop the pain. So CAD puts you at high risk of developing a heart attack, because as that blockage becomes tighter and tighter, the muscle loses blood flow, it starts to become starved, and then if there's an acute occlusion, meaning that that vessel finally shuts down for whatever reason, then the heart muscle starts to die, and that is what causes a heart attack. As Dr. Shu mentioned, that's the worst case scenario. That's the end stage. It becomes an emergency, and that puts you at risk for having a poor outcome. So we do try to prevent things from getting to that level.
Thank you. We have a few more questions for you. I want to remind our viewers, if you have any additional questions about coronary artery disease, please, coronary artery disease, I think I said artery there, coronary artery disease, please ask them in the comments, and we'll get them to our physicians here. So we talked a lot about risk factors, diagnosis, also what could lead to if you don't have treatment of CAD. What can CAD lead to any other heart conditions, Dr. Shu?
Yeah, actually segues really well into what we do in our clinic, in the heart failure clinic. We have a team of 1 nurse practitioner and 4 heart doctors who sometimes see folks who have that massive heart attack where the muscle does not get enough blood flow to the muscle, and part of it or all of the heart muscle dies off. And when the heart muscle dies off, you can't get it back. It's gone. So the heart muscle becomes weaker and weaker, and we have to take care of people with weak hearts. Patients don't really feel weak hearts. It doesn't hurt anymore, but they have symptoms of heart failure. So when that heart pump, that's ultimately what the heart muscle does, it pumps blood forward. If that pump doesn't work very well, you swell up with fluid. You have fluid retention, salt retention, and then you can't breathe. You get short of breath, you get fatigue, and that's one of the major things that can happen after a heart attack. Other things that can happen, you can have very bad valve disease, but most of the time when you have a missed heart attack, a heart attack that goes without treatment early on enough, then you have weakness in the heart muscle.
So let's talk a little bit about treatment. How is CAD?
Well, that I would say it takes a team approach. Everyone from your primary care physician, who is involved with screening and also starting you on some medications that can be helpful in the treatment of coronary artery disease, such as making sure that you're on the proper blood pressure medications, helping to manage your diabetes. But then there are also specialists that are involved, and that's where a cardiologist like Dr. Shu comes in. The specialist can talk about more advanced therapies and other medications that may be helpful in slowing the disease. And they can also do special testing, to see, one, if there has been damage to the heart and how much, and whether we need to move on to more aggressive therapies. So your primary care cardiologist, but there are also what we call interventionalists. Mm-hmm. So an interventional cardiologist would be the one who does the coronary angiogram to definitively diagnose coronary artery disease, but they can also treat them at the same time. They can put stents in that can help to reopen those blood vessels, and that's a treatment that has been around for some time and is very effective. Then there's someone like me, a surgeon, kind of the end of the line, so to speak, and probably the last person that anyone would want to see when we talk about open heart surgery. Right. But it is one of the most effective ways of treating coronary artery disease, and it can actually help to restore not only your quality of life, but your length of life too. It can actually extend how long that you can live with coronary artery disease by having coronary artery bypass surgery. So it's definitely a team approach, and that's why it's important that patients keep up with their physician.
You have the primary care physicians working with the specialists, and you working as the surgeon and the severity of their condition.
Absolutely. Yep. The communication is very important. That's one of the things I would say that our group is very good at doing. The follow through, the communication, making sure that everyone is on the same page as far as treatment plan for each patient.
Wonderful, thank you. So what you mentioned some types of physicians that typically treat and manage CAD. Are there others that weren't mentioned? This is for both of you.
Great question. I think there's a whole cascade of doctors, starting with, again, EMS in the emergency physicians. When patients don't have an emergency, they usually have the primary care physician where you have a massive heart attack. You have doctors like me who work on folks who have the heart attack and may have heart failure afterwards. They help us along the way. For certain patients, open heart surgery is a better option, actually, than putting stents in. We know for patients with diabetes and certain amount of heart disease that open heart surgery, although initially there's a bigger recovery period, and you can speak more to this, Dr. Quarrie, but long term they have more benefit than just putting stents in. So there's a big team of doctors and medical personnel who take care of a patient who might have coronary disease, CAD. And this is a condition that needs to be followed even afterwards, after you come in.
Okay. Anything else you'd like to share with our audience today? That's all the questions that we have.
No, I think we
covered a lot. Thank you. This is very informative.
Very comprehensive overview of coronary artery disease, who it affects, how it happens, and what you need to do after.
Yep. Well, thank you very much. We appreciate all the information. If you would like some more information or to schedule an appointment with Dr. Quarrie or Dr. Shu, you can call 410-554-6550 and stick around. Up next, we're going to talk about coronary artery disease with Dr. Ruiz in Spanish. So thank you very much for joining us today, and thank you. Appreciate it.
Thank you.